I think if we appeal to the best in people and remind them of the mission of the great medical heritage, we can see positive change.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. We're honored to have Dr. Marty Makary here on campus at UT Dallas for the Business of Healthcare podcast. Marty is a surgeon and professor of health policy at Johns Hopkins University and the author of the New York Times bestseller, Unaccountable: What Hospitals Won't Tell You and How Transparency Can Revolutionize Healthcare. Welcome to the podcast, Marty.
Great to be with you, Bob.
So I understand you also are a writer for the Wall Street Journal, USA Today, Time, Newsweek, quite a nice collection of places where you can get the word out. But most recently, you have a latest book that's hitting the market, The Price We Pay: What Broke American Healthcare and How to Fix It. Honestly, I had a very hard time putting it down. Each story was so compelling and carried a very real, visceral, and emotional context. Share with us how you and your colleagues at Johns Hopkins started this mission of restoring the business of medicine.
Well, I was it was a great experience writing this book because I left discouraged by the money games of medicine, but at the same time so inspired and optimistic by all of the innovators and people who are really disrupting the industry. You know, in no other industry would we accept complete opacity of prices. In no other industry would we accept the degree of middleman that we have in healthcare. And in no other industry would we accept the amount of unnecessary services that are administered as they are in healthcare today. And so everybody's got an opinion on healthcare, but my task over the last 3 years was really to do the research to get at the underlying drivers of why healthcare is so unaffordable, why it's consuming almost half of our federal taxes in every way that it receives money. And I left really with 3 root causes. Number 1, pricing failures. Number 2, middlemen. And number 3, inappropriate care. And for each problem that I really try to tell through stories, because I don't think anybody wants to read a policy book, I learned about incredible disruption that's happening right now, and it was really cool.
Well, you liken the current state of healthcare in America to the 2007-2008 financial bubble that was so devastating to the economy. How do you compare the two?
Well, I have 2 serious concerns leaving the research from this book. Number 1 is the great public trust in the medical profession is now being threatened by the many money games. And people are at home sick and scared to go to the hospital for fear of price gouging and predatory billing. And I also left with a concern that we may have built a house of cards. You know, last year, healthcare became the number 1 business in the United States by just the dollars. And I'm not sure that's something to be proud of as a country. Doing things on your own people, prescribing things. There's almost 1 prescription for every American for opioids. We can do a lot better. And one of the root issues is that when you have a lack of transparency, it enables price gouging. And it's a basic economic principle. It's going on all the time in healthcare. People are fed up. Everyday Americans are getting crushed. And I was reminded in writing this book that most people don't live like me and you. They live with less than a couple $100s of cash on hand. And for them, a $1,500 surprise bill can be devastating. So I think a lot of times the medical establishment forgets how a lot of America lives, and they come up with systems that really sort of suit them, but not everybody. So I think we can ask some basic principles. If there was a travel website that you went to book an airline ticket and no prices, imagine looking up a flight and there were no prices and you got billed afterwards. And maybe you'd ask the airline industry, I want to know what the price is going to be for this flight from Dallas to Los Angeles, and they would say, we can't give you a price. We don't know if there's going to be a delay or a cancellation, or the pilot could experience turbulence and have to bill for more work units. And in fact, the plane could crash. We can't give you a price. We would say the price gouging that is enabled by the lack of price transparency is unacceptable. And in healthcare, we have exactly that. For 50 years, hospitals have been telling us they can't give us a price. It's embarrassing. Academic hospitals in the United States are the center of scientific genius. I'm a surgeon myself. I'm embarrassed we can't give you a price for things. And so people are now demanding better. And I think this is the exciting movement that we're seeing in healthcare. The Free Market Medical Association, the price transparency effort, the Oklahoma Surgery Center, and the many disruptors that are saying, hey, we can clean up the markets and make them competent and efficient and give honest prices.
Okay, with respect to the bubble of the economic disaster of 2008, is there a potential bubble here as well with devastating consequences associated with healthcare?
I think it's a serious concern. I mean, I'm optimistic on healthcare, but sometimes things have to get worse before they get better. And I think right now we're either about to hit a major downturn because of the bloated $3.5 trillion spend on healthcare, or we are in the process of picking up the pieces of the shattered vase, and we're saying, how can we put this together and redesign healthcare? I met people who were saying, hey, maybe we can consider food as medicine and treat back pain with ibuprofen and ice instead of surgery and opioids, and use cooking classes as a way to treat diabetes. And you're seeing the growth of relationship-based medicine and lifestyle medicine. The American College of Lifestyle Medicine, brand new. I mean, there's a whole new movement now to say, can we make healthcare more efficient, more patient-centered, and more honest? And that's everything from pricing to bedside care.
Well, you talk about predatory pricing, and one of the chapters in your book is called Welcome to the Game. It's a stupid game, and who gets played? If you would, expand a little bit on the game. What is this game that you make reference to?
Well, first of all, Bob, I'm convinced we don't have evil people in healthcare. We have good people, and they're going into it, and it's a bad system they're going into. I mean, I've talked to so many executives of insurance companies and hospitals, and even folks in the middle industries. They're doing their best. You know, people that go into healthcare are going into it for great reasons. My colleagues in my surgical department, the nurses, they're different from the other students in high school that chose other careers. We attract incredible people from the business to the bedside care. But what we've inherited is this ugly money game of what I call the markup discounting. And what happens is the hospitals come to the table to negotiate contracts with the insurance providers, and the insurance companies want a bigger and bigger discount, and the hospitals mark up the bills and increase the discount. And as long as you can stay on top, that is, increase the markup a little more than the increase in the discount, then good job. You've brought in $1 million for the hospital through this sort of manipulation of the instruments in contract negotiation and pricing, and now you're promoted. And it's like, what is this? The amount of non-patient facing people working hard on healthcare who are not delivering care, but instead playing these games, it's exhausting. I mean, look at the space of reporting quality measures, $16 billion a year just in reporting quality measures. That's the equivalent of every doctor having half of a full-time equivalent. Ask doctors what they'd prefer, having a helper or this massive reporting burden. And we haven't been reporting on the appropriateness of care, just on complication rates. And that was something else I learned a lot about, is that we're getting at the idea of what's the most appropriate care? How do we use big data to see signals of outliers? And how can we use civility to report data back to doctors to allow them to auto-correct? And I think in the end, what I really was inspired by is when you appeal to the best in people, they perform their best. And right now, we need to remind people why we all went into medicine. As much as there's been a pile on about hospital prices At the same time, there's hospitals that are doing the right thing, even though it may not increase their profits. We see some hospitals in the United States, in our sample reported in JAMA, a third of hospitals will sue patients for unpaid bills. Most hospitals don't. When American hospitals were built, they were built to be a safe haven for the sick and injured. They were built by their communities. Most were built by churches. That is the great heritage of the medical profession. That incredible public trust today is threatened by these many money games. And in order to address it, we have to understand them. There are things we can do from talking to policymakers to making our own decisions. And whether or not the government does anything, and I have no confidence that they will, there's a lot that we can do to disrupt it just based on our decisions and consumer choices.
Well, I think the awareness factor of knowing some of this disruptive activity and some of this predatory pricing and some of these practices, you just cannot imagine that they're actually taking place in the real world. And you give examples of a hospital in New Mexico where everybody in this small town, almost everybody in the small town, has been sued by the hospital. And the prices that they were charged were like 1,000 times more than what they should be. I'm using that number as a placeholder, but outrageous cost. And how do you go about resolving some of these issues? You talk about the ride where people are being exploited in terms of cost to get to medical care, whether it be a helicopter or a plane or an ambulance. And some people come up with innovative ways to disrupt that and really put a competitive nature, expose how bad these problems are. Talk a little bit more about that. Do you see hope out there for finding ways to normalize this back and bring attention to people so that they are not blindly aware of how bad it is? I mean, on the radio, on TV, if these things were exposed, I think you'd have a whole revolution in place if people knew about it.
Well, I think if we appeal to the best in people and remind them of the mission of the great medical heritage, we can see positive change. Now, when I was doing the research for this book, The Price We Pay, on healthcare costs, trying to understand why is it cost so much and what can we do about it, I was blown away to discover that these hospitals are suing the crap out of their town sometimes. I was so bothered by this that you couldn't help but want to do something. You meet a single mom who's got two full-time waitressing jobs in order to pay for her kids to have food because her paycheck, which was at minimum wage, was garnished by the local community hospital for a bill that she couldn't afford. And you think, have some mercy. I mean, hospitals were supposed to be a refuge for the sick and injured. And my hospital has it at the main entrance at Johns Hopkins Hospital, a 9-foot statue right when you walk in the front door, staring you in the face of Jesus with open arms. It's not a religious institution, never was. But the verse, "Come to me, all ye who are heavy laden, and I will give you rest," is engraved right there. That's the great spirit. We take care of anyone. Who else has a sense of equality than witnesses of birth and death, it's been said. And I think there's this incredible sort of equality intrinsic in healthcare. So when I found out these hospitals were suing the crap out of people, yeah, you better believe I was upset. And I told my students, and they said, we want to come with you. We're going to go down there. We're going to meet these people. We're going to document it because the hospital executives were giving us some corporate speak that this doesn't actually happen. We documented it. We published it in JAMA. And it turns out that in one hospital, they had sued 25,000 people in a town of 28,000 people by census. And we're shutting it down. We went to the hospital, asked them to stop, reminded them why we went into medicine, told them they're violating the great public trust of the medical profession, and they announced immediately afterwards that they're going to stop all lawsuits. We then took that to Memphis. We're taking it to Carlsbad. CNN, the New York Times are doing pieces on Carlsbad, New Mexico. Shame on them. That hospital corporate system owns over 100 hospitals in the United States, and they're suing people all over the place. Shame on them. They're violating the great public trust. And when I see people fired up, it reminds me that don't listen to the cable news echo chambers, the political bantering of the soundbite grenades that would tell us we're a divided people, that there's a pro-anti-Obamacare dialogue. Right. That's not the right framing. There is tremendous consensus around the United States that we should have honest pricing. There's tremendous consensus that we should not have kickbacks in medicine, and there's a tremendous consensus that we need to preserve the great medical public trust.
Well, I think that trust is a key element. In hazardous situations or emotionally tense situations, which healthcare has a lot of, that's where you need to have pricing transparency. I understand by reading in your book that once you die, funeral directors actually are required to give you total transparency on cost.
Yeah, they have to give you an estimate.
Yeah, have to give you a valid estimate on what the services are going to be. It's a shame that you have to die first. And why did they do that for funeral directors? Because that's a very emotional and distressed time.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
When it comes to transparency, like you mentioned, that when there's veil of blockage, we don't see the cost. What can be done? Who will make that initiative? Is there anything underway in the government right now that is trying to force this transparency to be more prevalent and accepted?
You know, several of us in academics were invited in when President Trump got elected, and this is an ongoing thing. When new politicians come to Washington, what do they want to do? They want to champion good ideas, and there's an open internal market for good ideas. And in academics, we are not beholden to stakeholders. We can speak our mind. And anyone who knows me or reads my work knows I speak my mind. And, what I said and what a couple others said independently was Americans are hungry for honesty in healthcare. They want honest pricing. And right now we have an incompetent marketplace that's entirely enabled price gouging. President Trump listened, and I brought in twice patients who had been gouged, absurd stories, and they're unlimited, the number of stories out there right now. And they listened. Secretary Azar, Secretary of Health and Human Services, they listened, and they made an announcement on surprise billing. They made an announcement on price transparency, and the president very recently signed an executive order mandating transparency of the secret negotiated rates between hospitals and insurance companies. That's going to do a lot for the market once it gets implemented. And right now they want to hear you from everyday Americans in the public comment section of the Department of Health and Human Services website, or Patient Rights Advocate allows people to weigh in. But they want to hear from everyday Americans. If we let special interests run Washington, D.C., life will be good for everybody except for one special interest, and that's the patient. And right now, everybody's doing great. Everybody is doing really well. If you don't believe me, take a look at the earnings on Wall Street of hospital corporations. Take a look at the earnings of insurance companies, United. And by the way, I don't have anything against United or insurance companies, and I meet terrific people running these organizations. But look at their earnings report, 25% increase in one quarterly earnings call, 25% increase for an insurance business, an actuarial business. When asked, why are the earnings so strong? They said, in part from their pharmacy benefit plan. And people don't even know what a PBM is. They don't know what a GPO is. They don't even know how health insurance brokers work. This is the healthcare literacy that we need broadly in the United States. And that's why I wrote the book, The Price We Pay.
Yeah, The Price We Pay has a great example of selling Girl Scout cookies and how that relates to being a PBM. And those type of very clear, simple, communicated stories really help people understand the situation that we're in here. Moving forward, what do you see the future? Obviously, it's easy to identify some of these outrageous situations and these compelling stories of predatory pricing and unfairness. What do you see some of the disruptive innovation that is in a positive direction that might help us get back on our mission of medicine?
Well, I think we're seeing some really exciting things right now, Bob. We're seeing public accountability at the community hospital level, reminding hospitals that these hospitals were built by their communities to serve their communities. Board members of hospitals, they should be accountable for these outrageous bills. And by the way, they're local business and community leaders who serve on these boards. We've encouraged people through restoringmedicine.org to talk to your board members. Ask them if the hospital engages in predatory pricing or in crazy billing practices. We're seeing the growth of relationship-based medicine as one example of physician innovation. Primary care clinics that are saying, we want to spend time with patients because the current system that the fee-for-service model has given us of seeing patients for 10 minutes, and no wonder doctors are burnt out. I couldn't do that for an hour in medical school. I was almost burnt out in 1 hour of doing clinic-based medicine, seeing 5 patients, 10 minutes each. These new clinics, Iora, ChenMed, Landmark, Oak Street, they're saying, let us take care of patients the way we want. Let's forget about billing. Let's just take care of the patients. And I guarantee you at the end of the year, that population is going to be healthier if you just let us be doctors. I believe doctors are not lazy people. We just don't want to spend our time on things that don't matter. We don't want to be rushed. And by the way, the patients don't like it easy either. And what you're seeing right now is a complete disruption of the old model of primary care, which is you come to see your doctor and the doctor says, you need to do this and this. It's not that they don't know what to do. It's they don't know how they need help. And then they come back for a follow-up and the doctor says, you didn't do this or that, and they feel guilty. That's a horrible model of being a doctor. The new model says, hey, these are the goals we'd like to set together. Everyone's assigned a health coach and navigator. They help coordinate your care and help you stay healthy and encourage a good lifestyle. They'll come to your home or do whatever it takes to intercept an unnecessary visit to the emergency room. They're your friend. They don't have to be physicians or even nurses. They can be anyone with an incredible sense of empathy that works on a team with a physician. And so they have these fleets of helpers, coaches, navigators that partner with people and achieve great health. That's great relationship-based medicine. That's redesigning medicine from scratch and creating something awesome.
You mentioned restoringmedicine.org. Tell us a little bit about that.
Yeah, that was a lot of fun working to get that group going with the medical students. When they heard about the price gouging, when they saw the stories like Steph, the waitress who took 2 full-time jobs because her paycheck was being garnished by her community hospital. She's the single mom of 3 kids, makes too much to qualify for Medicaid. They wanted to do something. You know, right now, young people are part of a social justice-minded generation, and they want to do stuff. And they don't care necessarily if they're wearing the best business suit or living in a big home. It's a different mindset at all from the previous generation. They want to be a part of something greater than themselves. And so they started restoringmedicine.org, and it's really empowered people to get involved in their community, create public accountability for local hospitals, and to get involved politically in a way where there's broad consensus in America and not be a part of this partisan back and forth facade of an argument that's been presented to us.
Right. Well, this has been a delightful time spending time with you, Marty Makary. The Price We Pay, a new book coming out. It's out this week, and it's very exciting. I think it's going to be a standard issue for all of our students here. So thank you for taking the time and joining us here at our studio. We appreciate it.
Well, thanks, Bob. It's great to be here at UT, so thanks for having me.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.